health services in the country. Some software engineers at IT Gurus already have the technology up and running for 5 years now. Although only private and faith-based facilities have embraced the technology, thereby leaving out public facilities that tend to a large number of patients. But just how does this technology work? And how does it help improve the provision of healthcare in the enrolled facilities? Elizabeth Atino takes us through this journey.
Kingangi Gitao and Kenneth Njeru are software engineers and founders of Clinical Data Management Solutions, CDMS, and Africa Afya Healthcare Solutions, respectively. The CDMS is a software that makes it easier for doctors to access the patient's medical history and offer the right form of treatment.
We've tried to keep the system as simple as possible. One of the problems I noticed with the systems out there is the clutter, the screen clutter. I also noticed that medics don't like too much technology and clutter on with their work.
This is how the technology works. Let's say patient X, who we shall call Nyokabi, visits a health facility that has adopted the CDMS technology. A doctor will use his username and password, normally encrypted, to log into the platform. Thereafter, Nyokabi will fill in some of the information needed to come up with her patient database, which will help in future diagnosis.
I'm running a hospital. The people I create here are the ones allowed to see that data. Not anyone else can see it. And their passwords are encrypted, the data is encrypted. No one outside the domain can see the data. By the time you're inside the domain, you're a worker of the facility, you have permission to see records. So the management have to agree to be sharing data. So if they have agreed, then there's no problem. So it starts with the management. They have to agree to share information.
Let's say Nyokabi is currently seeking treatment in a facility around Nairobi. Then she falls ill a few weeks later in a different county, for instance, Kisumu. The doctor in Kisumu will also be able to access Nyokabi's medical history as long as the facility is connected to the CDMS platform.
If we knew the ailments our grandfathers used to suffer from, maybe we would do things a bit better. So you can imagine several years ahead, if we've collected this data and it's accessible, you have kids, you have grandkids, you can track.
All patients whose data is currently in the CDMS system are able to register for hospital admission and secure a bed in the facility.
Other departments like admissions for inpatient are available. Over here, we can even manage the beds, the wards. I cannot assign a bed to a person when it's occupied. If I try to choose it for an admission, it will be grayed out. It won't be available.
And after the patient is through with admission, the accumulative hospital bill will automatically reflect in the CDMS database while issuing different forms of payment like M-Pesa, manual, or insurance. The software also has an inventory management system that helps prevent cases of theft of medicines in the facility, as the management is able to keep a stock check on the number of drugs delivered and those remaining.
This is to prevent theft, because everyone signs in every step. Their ID is recorded against their action. There's an audit table in the background. I can pull it up if I suspect fraud to track down the medication. Obviously, in healthcare, people die. So when somebody has demised, you record that, you end the care. There's a care ended part. You record the reason the care has ended. Have they passed on? Have they traveled to another country? Have they healed?
Currently, Kenya has not more than 150 radiologists. This clearly shows the backlog being witnessed in the MRI, X-ray, and CT scans. But Kenneth Njeru now explains how Africa Afya Healthcare has come up with the technology through partnership with DataMate and Expert Eye Teleradiology.
Say you need an MRI, you go to Nairobi Hospital, and they do not have a radiologist. So they do your MRI, and it's transmitted to the database simultaneously once it's done, and then the radiologist who has access to that platform can view the image, can interpret the image, and our platform has several tools for even measurements, since you find some of these things really are a matter of millimeters, so they can measure and see what's wrong and make a diagnosis and write a report and send it back. And that helps in the accuracy of their reports.
The 30th of June this year, the government launched the e-Citizen platform that will make over 500 government services, including health, available online. But unfortunately, only private facilities have embraced the CDMS technology. The founders say reaching out to public health facilities is still an uphill task.
We are aware that working with the government is a hard task, straight off from getting that tender and getting paid for that tender.
Elizabeth Atieno, TV47, Nairobi.
That Elizabeth Atieno.